Good afternoon, dear colleagues and guests. Let me declare open the session of the Dissertation Council for the Defense of Thesis by Korolev Dmitrii Vladimirovich for the degree of Doctor of Chemical Sciences on the theme Specialization 020021020016 Solid State Chemistry Medical on the theme Development of Drugs for Teranostics and Targeted Delivery of Cardioprotective Substances based on silica and magnetic nanoparticles. According to the order of St. Petersburg University, dated the 12th of November 2019, number 11-23-8/1, me, Smirnov Vladimir Mikhailovich, Professor, Doctor of Chemical Sciences, Professor of Solid State Chemistry Department at the Institute of Chemistry of St. Petersburg University, was appointed Chairman of this Dissertation Council. Let me also introduce my fellow council members. Tolstoy Valery Pavlovich, Doctor of Chemical Sciences, Senior Researcher, Professor, Solid State Chemistry Department, Institute of Chemistry, St. Petersburg University. Sharoyko Vladimir Vladimirovich, Doctor of Biological Sciences, Senior Researcher in the Department Laboratory of Biomedical Chemistry, Institute of Chemistry, St. Petersburg University. Garabajeu Alexander Vasilyevich, Doctor of Chemical Sciences, Professor, Vice Rector for Research at St. Petersburg State Technological Institute, Technical University. Maligin Anatoly Alexeyevich, Doctor of Chemistry, Professor, Head of the Department of Chemical, Nanotechnology and Electronics, St. Petersburg State Technological Institute, Technical University. Ostrovsky Vladimir Aronovich, Doctor of Chemical Sciences, Professor, Department of Chemistry and Technology, of Organic Synthesis of Organic Nitrogen Compounds at Petersburg State Technological Institute, Technical University. Semyonov Konstantin Nikolaevich, Doctor of Chemical Sciences, Head of the Department of General and Bioorganic Chemistry, First St. Petersburg Medical University, named after academician Pavlov. Shilova Olga Alexeyevna, Doctor of Chemical Sciences, Professor, Acting Deputy Director for Research at Institute of Silicates Chemistry of the Russian Academy of Sciences, named after Grebenshikov. Kudryavtsev Konstantin Viktorovich, Doctor of Chemical Sciences, Associate Professor, Department of Medical Chemistry and Bioorganic Synthesis, Faculty of Chemistry, Lomonosov, Moscow State University. In the remote mode, we have Torchilin Vladimir Petrovich, Doctor of Chemical Sciences, Northeastern University, USA. Poklonsky Nikolai Alexandrovich, Doctor of Physical and Mathematical Sciences, Professor, Department of Semiconductor and Nanoelectronics, Belarusian State University, Belarus. Also, the meeting is attended by the scientific advisor of the applicant, Doctor of Chemical Sciences, Professor, Head of the Department of Solid State Chemistry at the Institute of Chemistry, St. Petersburg University, Murin Igor Vasilyevich. First, I would like to emphasize that according to the federal law on the 23rd of August 1996 on science and the state scientific and technical policy, order number 127, St. Petersburg University has the right to award academic degrees independently. A corresponding order on the procedure for awarding academic degrees at St. Petersburg University, on the basis of which we are holding this session of the Council, was issued on the 1st of September 2016, order number 6828/1. Hereinafter referred to as the order. In accordance with the order, a session of the Dissertation Council is duly constituted if at least 2/3 of the approved members of the Council are present. As we decided, our Dissertation Council consists of 11 members. All the members are present, including 2 members of the Council, in the remote interactive mode. The audio-visual contact has been established with them, so we have the quorum. Let me set forth the procedure of today's session. The total duration should not exceed 2 hours. First, we shall start with the Chairman's summary report on the main content of documents. On the main content of documents submitted by the candidate and their compliance with the applicable requirements. Answers to possible questions, 5 minutes. Second, a brief presentation by the applicant outlining the key points of his study, 20 minutes. Questions to the applicant strictly related to his report, no more than 2 minutes per question, and answers of the applicant. Speeches of all the members of the Dissertation Council with their reviews in turn, with their opinions, questions, and opinions, questions and suggestions to the applicant, not more than 10 minutes for each speaker. 5. Speech of the chairman and his review. 6. Answers of the applicant to questions and remarks. Answers of the applicant to questions and remarks of members of the Dissertation Council. No more than 15 minutes. 7. Open discussion, speeches of the attendees with present at the session with summaries of their positions and or with specific questions and suggestions to the applicant, strictly on the topic of the study, not more than 5 minutes per person. At that, all the speakers are kindly requested to put their names on the registration sheet and introduce themselves in full before speaking. 8. Final answers of the applicant to questions asked, no more than 5 minutes per question. 9. Speech of the applicant's academic supervisor, no more than 3 minutes. 10. A 5-minute discussion before the open voting on awarding or not awarding the academic degree to the applicant. For the time of this discussion of the council members, the broadcasting shall be suspended, and attending non-members of the council shall leave the room. 12. Decision on awarding or not awarding the university academic degree to the applicant. And 13. Closing remarks on the applicant, no more than 2 minutes. Before we start the official procedure, let me remind you to switch off your mobile phones. Thank you for your understanding. Let me also inform you that our meeting shall be audio and video recorded and broadcast online at St. Petersburg University website, and the speeches are being simultaneously translated from Russian into English or from English into Russian. So, I shall now begin the session with our first item. We have to have a chairman's summary report. The thesis by Korolev Dmitrii Vladimirovich for the degree of Doctor of Chemical Sciences. Specializations 020021 solid state chemistry and 020016 medical chemistry, on the theme development of drugs for teраностикс and targeted delivery of cardioprotective substances. Based on silica and magnetic nanoparticles, was accepted for defense by the order of the Academic Secretary of St. Petersburg University, dated the 12th of November 2019, number 11-23-6/1. The Dissertation Council was appointed by the order of the Academic Secretary of St. Petersburg University on the 12th of November 2019, 11-23-8/1, and I have already introduced to you, dear colleagues and guests, all its members. Second, the applicant submitted the following documents to the Academic Secretary of St. Petersburg University. An application to the Rector of St. Petersburg University, corresponding member of the Russian Academy of Sciences, Professor Kropotchev, to accept the thesis for consideration and defense. Submitted on the 1st of October 2019. Second, a review of the academic supervisor, Muri Igor Vasilovich, Doctor of Chemical Sciences, Professor, Head of the Solid State Chemistry Department of St. Petersburg University. Third, list of publications of 10 works which set forth the main scientific results of the thesis, including in peer-reviewed scientific journals from the list approved by the Ministry of Education Science of Russia, 2 publications, in journals indexed in the scientometric databases Web of Science and Scopus, 8 publications. 4. Candidate of Science Diploma, properly numbered, issued on the 27th of October 2000, which certifies that according to the decision of the Dissertation Council of Pittsburgh State Technological Institute, Technical University, on the 30th of June 2000, number 27, Korolev Dmitrii Vladimirovich was awarded degree of candidate of chemical sciences. 5. A conclusion of the organization where the thesis was written. National Medical Research Center, named after Almazov, on the thesis. The thesis in Russian and in English, on paper, on the rights of manuscript, and in the electronic form. The thesis has been formatted in accordance with the requirements of state standard, printed on a multiplier with indication of the output data according to state standard. It should be noted that all the documents listed above comply with Clause 12. Section 3. Thesis, presentation and defense. Also of the procedure for awarding the academic degrees at St. Petersburg University. Annex 1 to the order. Now, let's give the floor to the applicant for his presentation. He has 20 minutes. Dear colleagues, good afternoon. The theme of my thesis, development of drugs for theranostics and targeted delivery of cardioprotective substances based on silica and magnetic nanoparticles. Since the word teranostics was mentioned, I'd like to illustrate this term. There are two approaches to this term. First is used by Russian scientists mainly. It sounds that approach to development of pharmaceutical compositions in addressing drugs. It same act as a means of early diagnostics and therapeutic agents. And there is a second definition of the term teranostics, part of a personalized medicine, where drugs are selected individually for each patient on the basis of their prognosed response and risk of disease. Both approaches have what they would call teranostics, is a synthesis of therapy and diagnostics. For cardioprotection, that means visualization of a heart attack zone and reducing it. When analyzing dynamics since 1980s, we found over 6,000 articles dedicated to theranostics. About half of them are dedicated to oncology, and about the other half to other diseases. About 100 articles dedicated to cardiology, and we found for articles on cardioprotection about 6 articles. And since ischemia is number one reason of mortality in most countries, I believe the subject theme of my thesis is highly relevant. The purpose of my study was to develop the basis for synthesis of theranostics preparations and targeted delivery of cardioprotective substances using silica and magnetic nanoparticles. According to this target, we used two approaches, solid-state chemistry and medical chemistry, which were brought together to synthesize conjugates and multi-layer nanostructures with properties that allow for diagnostics and therapy in the sphere of cardioprotection. In my thesis, I used two types of nanoparticles, industrially produced silica nanoparticles and magnetic nanoparticles, the synthesis of which was developed by the author. The synthesis was performed as a mixture of iron sulfates 2 and 3 in presence of ammonium oxalate. Half industrial reactors been purchased, upgraded to our purposes. A peristaltic pump feeding were installed. And with this reactor, we obtained magnetic nanoparticles. Here, as a result of this synthesis, we obtained about 2 liters of suspension of magnetic nanoparticles. The size of crystallites was about 20 nanometers. The qualitative composition of magnetic nanoparticles was studied by X-ray diffraction analysis. We found reflexes correspond to magnetite and goethite. The qualitative composition was studied by means of Mössbauer spectroscopy, but 10% of non-magnetic phase was found. The magnetic phases were 72% magnetite and 18% goethite. With the help of vibromagnetometer, we studied magnetic properties of nanomaterial. Magnetization was about 61 electromagnetic units per gram. The coercive force was about 30 oersteds. One of the first most important properties of all nanomaterials is their biodistribution and biodegradation. We have studied natural biodistribution of nanoparticles as following the following algorithm. We injected laboratory animals with nanoparticles, and organs were collected to study their biodistributions mineralized by wet nitric acid salinization. Generally speaking, biodistribution of magnetic nanoparticles we started with the help of 4 different methods: analytical, with the help of spectrophotometric method, atomic absorption spectroscopy, on isotope label 57, with the help of Mössbauer spectroscopy, and with help of immobilizing fluorophores and fluorescence with subsequent fluorescence tomography. It turned out that nanoparticles get accumulated in all the studied organs, and later this is followed by smooth decrease in concentration. The highest accumulation is in the kidney, pathometabolizing nanoparticles, and it's interesting that hematoencephalic barrier has been overcome. Also, we studied biodegradation of nanoparticles in vitro. We obtained samples, shifted Krebs buffer. This was followed by centrifugation and super spectrometric analysis. We found an increase in iron concentration in the solution, which manifests degradation of nanoparticles, biodegradation 95% of silica in only 41 days. The following biodegradation silica in vivo, the following C biodegradation was adopted: erosion of the surface, transition to water-soluble salts, circulation in blood, and removal through kidneys. Then we found gradual reduction of silica content in the liver, and after 30 days it reached endogenous level, which corresponds to the in vitro experiment. In order to immobilize any substance on the surface of nanoparticles, we need to create a spacer, and then with a functional group. The spacer link was used to immobilize active substances or fluorophores. And another task is to increase the distance between nanoparticles and fluorophore, which prevents extinguishing effect. We used functional group and other types of immobilization, such as hydrothermal, or applying the salt polymer coating for active substances and fluorescent dyes. We synthesized spacer with amino group, amino silines and glycine were used. We used solid phase, liquid phase for glycine and amino silines. For 3 amino acids, fluidized was reused. Also, for 3 amino acids, we used gas diffused method of application, for which we built a special facility. Further, the number of those groups was calculated by reverse calculations, and so we measured available number of amino groups with help of spectrometrically. It turned out the highest content was observed in diluted with benzene. The illuminated electron microscopy showed absence of agglomerates compared to initial samples, and analyzing the curves showed the magnetic properties increased. Maybe most barospectroscopy verified this guess. The 94% of magnetite present. This leak, creatine phosphate, was mobilized with the method of we demonstrated the presence of amino group in samples. The amount of creatine phosphate was determined spectrometrically, which was 88 milligrams per gram for magnetic nanoparticles. We achieved good result, 8 milligrams per gram. We conducted evaluation of fluorescent dyes for fluorescein first. We first did a coordination ion immobilization. So we found that hydrolysis occurs. Then we conducted covalent immobilization with chamomile method for amino group. The bond was strong, so we used this sample. Highest degree of fluorescence in vitro was studied on fluorescence thermograph. Further samples with fluorescein, including chamomile immobilization. For nanoparticles, with best result as seen. Best samples were studied in vivo, and we found that when injected, the preparation is not washed away, not washed out, and imaging time increases from 2 to 35 minutes. Here we observed prolongation effect. We also studied magnetic controlled delivery in vivo. A magnet was inserted in laboratory animals, and accumulation of magnetic nanoparticles with immobilized green in the cyanide in the zone with a magnet was detected. Falsely operated animals also showed such accumulation of nanoparticles, which shows is in favor of passive delivery. Synthesis of chitosan spacer was carried out from acidified organic acid. The best results achieved with citric acid. Introduction of crystallization centers in form of nanoparticles. We obtained particles with size of condensed of 80 to 100 nanometers. Immobilization on this spacer of in the cyanide green produced distribution in all the organs. Greatest accumulation was observed in liver, which manifests metabolization. For active substances and X-ray contrast dyes with amino hydroxy group, we synthesized carboxylane spacer with the help of amber anhydride. On this spacer, adenosine and bradykinin were mobilized on this spacer. Terminal acid. Also, we synthesized magnetic nanoparticles with X-ray contrast markers, evaluation of magnetic nanoparticles, and this will make it possible to use resonance and tomography together. It turned out that contrasting properties right on contrast of bone tissue, so achieve the desired effect. For covalent immobilization of active substances with proper secondary amines, we synthesized another type of spacer with the help of infrared spectroscopy. The presence of this spacer was evaluated with by three methods: 3-methylamine treatment and titration, mineralization, and measurement of by molybdenum blue and Pragal combustion. Best results were obtained from the synthesis of benzene. On this spacer, we immobilized cardioprotective quinacrine, and we obtained particles of 100 nanometers. Qualitative proof presence of quinacrine with IR spectroscopy, and so we showed the best result was obtained with benzene, and this sample has light attachment sufficient to use quinacrine as cardioprotection as fluorophore, because it has fluorophore properties. We applied coating with the help of fluorophore. The coating was formed of glucose. Polysaccharide was formed, and on this microphoto you may see quite a tight shell which can include fluorophore and medical substances. So we obtained light feedback with by inclusion of fluorescent dyes in this coating shell, but all the cardioprotective substances did not have sufficient, were not resistant to high temperatures. Then we introduced carboplatin, and carboplatin was introduced. Then the obtained sample with 5 milligrams per gram of carboplatinum. Coating was applied of polyactic acid was applied, also including carboplatinum, the content of which was 6 milligrams per gram. Average size was 170 nanometers, particle size, to introduce in the cyanide. It was necessary to synthesize conjugate, so we synthesized the conjugate with the help of ethylene diamide, which showed sufficient light output for visualization. And finally, we set ourselves the task to create for teranostics a complex structure which includes the nanoparticles, glycine spacer, quinacrine covered with ketazine coating on which fluorophore was immobilized. Fluorophore was in the cyanide green. The fluorescent spectroscopy enabled us to detect presence of quinacrine, and fluorescence tomography proved this, which enabled us to prove the presence of either-sided green colloid quantum dots on the surface. And finally, we conducted experiment of in vivo ex vivo tests, protocol of our experiment included 30-minute ischemia, occlusion of blood flow. Then our preparation was injected, and 120 minutes of reperfusion followed. In vivo, we achieved a fairly good result of during 20 minutes, and in heart cross sections we may see accumulations in impaction zone, and we also determined metabolization path through liver. This was the final stage of our study. At that, to save time, let me not read the main results and conclusions. These you can find in my thesis. Thank you for your attention. Sorry. Okay. Now, as members of the dissertation council and attendees, colleagues have the opportunity to ask short questions, 2 minutes, and answers of the these shall be followed by answers of the applicant. To save time, I have several questions. Dmitrii Vladimirovich, how stable are nanoparticles that you obtained? You mean nanoparticles? Let's divide initial and in bound with therapeutic substance. So these were nanoparticles were extremely unstable, but their stability grows when coating is applied. As for final nanoparticles, core shell structures which are introduced, these we've had them for 1 year, they are still okay. So what's the reproducibility? What's the reproducibility for distribution of by size of your nanoparticles? The initial size of magnetic nanoparticles we have been obtaining during the 3 years in this reactor. Before we use laboratory synthesis, we regularly give them to the university for magnetometer, and size of crystallites is also the same. And last question: what is the basis for the choice of spaces? Which methodology did you use? Complementarity to substances to be immobilized. Yes. Who else has questions? Welcome, Olga Alexeyevna. Could you please tell us, you announced the use of magnetic particles and non-magnetic particles, but there is no definite conclusion which is better, or it depends on the purpose. It will be interesting to know the therapeutic effect on the patient, and how in general, apart from something can be under the influence of magnet. Can you make some conclusions? Yes, Olga Alexeyevna. My second question is what minimum and maximum sizes of magnetic particles, because we know that at certain size particles stop to coagulate. So what size of particles for carrier for drug carrier, or for drug carrier that doesn't matter? These are my questions. As for your first question, maybe I omitted this in my presentation. We tried synthesis of spacer and atomization of substances on silica and magnetic nanoparticles. Here I'm talking about different types of delivery. And the magnetic nanoparticles are subject to simplest magnetic field. Silica nanoparticles, passive accumulation, and then maybe could be something, some target vector could be attributed that will bring them inside the cell. Also, magnetic nanoparticles have such property. It's necessary to lengthen spaces to stop extinguishing effect. This we also did. So mostly, yes, of course, these are different types, different methods of delivery. Both particles get metabolized, removed, put out. Metabolism, the time of metabolism depends. It's different. About side effects, this we need to investigate further. This requires further investigation. We just outlined some principles, general principles. About sizes, we did not obtain magnetic nanoparticles in the initial state that did not coagulate. Always achieve this with modification of surface. So this is we did either by well-known citrate method or with the help of threamine. We just close the surface with silicone, and then they do not coagulate. To achieve such size at which they wouldn't coagulate by themselves, we did not manage to achieve this. May I also ask a question after Olga Alexeyevna? The situation is, when we talk about drug delivery, it's important size of particle to have particles of particular size, because world public community believes that such particles should be super paramagnetic, not just magnetic. And in your work you show that if particle size is above certain value, I will not go into details, then particles turn to ferromagnetic, and this do you have an opinion about that? I don't remember if I came across the term super paramagnetism in your thesis. Yes, as MISBA spectroscopy, super paramagnetic, we obtain a mixture of super paramagnetic with ferromagnetic particles, but this is connected. Before we close them with coating, they grow bigger, and the size of crystallize reaches 20 and 100 nanometric diameter is 120 nanometers, so which consists of several particles. So size 20 nanometers is enough for this particle not to have any negative properties, not to display negative properties. Good afternoon, dear colleagues. I have a question. Creatine phosphate. Because of chemical nature of such molecule, its penetration is quite hard. How this modification of this molecule improved penetration? And second part of my question, how did metabolism profile changed if you did targeted delivery of creatine phosphate? We believed that if nanoparticles have good penetration properties, they can bring creatine phosphate with them. That's what we wanted to achieve. As for metabolism, for over a long period, we have not studied it, unfortunately. But yes, this we can study. Do we have further questions? I have a question, please. Please go ahead. Here is my question. In your experiment on animals, have you tried how to assess how the size of how chemia changes with your preparation, without your preparation, how chemia changes. Yes, of course, we tried. I showed this. This picture was in the first slide. I did not spend enough time on it to save time. Here is this picture. So we injected laboratory animals with adenosine, mobilized on silica nanoparticles, mobilized, and this infection size grew smaller. You can see that very clearly here. And this was published. We published this in an article back in 2012. Thank you. More questions, please? Dmitrii Vladimirovich, could you please tell us, one of the slides you showed a synthesis method, and you said that you coated monomer glucose, and as a result of your synthesis you achieved a polysaccharide. Could you comment how polysaccharide was formed? Hydrothermal synthesis in autoclave we used. What happens at increased temperature and increased pressure with glucose? We judged the result of spectroscopy, where in sample we found deviations in pyranose, and we suppose that something like this happens. Something also same phenomenon can be observed in described in articles. Not maybe not exactly polysaccharide. Maybe that's a wrong term, but with development of synthesis of hydrocarbon quantum dots, it's similar to some kind of carbon structure. Yes, graphene. Yes, Konstantin Nikolaevich was more questions. Okay, please have a seat. Dmitrii Vladimirovich, could you please tell us, mice, different color, white and dark, were these linear mice with a linear response to impact, external impact? For white mice, these were rats. Stockovister status. As for black mice, these were linear mice. Unfortunately, I don't remember exactly which line. Okay, everything is clear. Thank you. I confused rats with mice. Thank you. That's all. That's all. More questions? No more questions. Please have a seat. Now I can. I'm okay standing. Now we shall give the floor to. We shall hear the reviews, excluding external reviews. Let me read 5 external reviews, and then each member of the dissertation council shall read his review to save time. I will present a summary, though for me it's not easy. First, reviews by academician Buznik, who works at National Research Institute of Aviation Materials. From academician Buznik, National Scientific Research Institute of Aviation Material. The author observes that full analysis, literature observes important aspect of the thesis of great practical relevance in clinical application is the study of biodegradation of studied nanomaterials. Then he lists the new sections, the new and conclusions. Further, the author mentions a complex approach to the goal of the thesis, and the author was able to prove that passive delivery of drugs works on the model of laboratory animals, and only then began to study and then began to synthesize a wide class of modified nanoparticles to solve the main material science problem. So the review is positive. The next review by Professor Vlasov, head of department of pathophysiology of the first medical institute named after Pavlov. In his review, here the author, which I just noted, pays attention that 49 articles were published by the author, which is a little different, so you reduced the number. You only mentioned 8 articles on the theme of the thesis, so this should also be taken into consideration. And the author emphasizes importance of the field of study, of research. It's important that Korolev suggested a new direction of teraностикс with the use of nanoparticles on different carriers, including preparations with targeted properties. And in conclusion, there are no critical or negative comments. The reviewer says the thesis corresponds to the requirements established at St. Petersburg University, and the author deserves to be awarded the degree of Doctor of Chemical Sciences. A third review from Manshina Alina Anvarovna, Doctor of Chemical Sciences, Professor, Department of Laser Chemistry and Laser Material Science, St. Petersburg University. Here, also, the author observes good available literature is good covered, is well covered. Active magnetic guided delivery of conjugates of magnetic nanoparticles is a valuable approach to addressing the task set by the author. And then, without any critical comments, Professor Manshina observes that the thesis complies with the requirements of St. Petersburg University, and Korolev Dmitrii Vladimirovich deserves to be awarded the degree of Doctor of Chemical Sciences. Next, fourth review submitted by Doctor of Chemical Sciences, senior researcher of the Federal State Center for Crystallography and Photonics of Russian Academy of Sciences, Professor Ivanov Shits. Here the author observes also importance of using nanoparticles for medical purposes and their biocompatibility. Further, the author defines importance of work performed by the applicant as among the drawbacks of the thesis. He says morphology and crystalline structure of resulting magnetic nanoparticles insufficiently described. Secondly, it would be interesting to see a more detailed study of processes of aggregation of obtained nanoparticles and sedimentary stability of suspension based on them, as there is, according to the author himself, an aggregation that affects sedimentary stability of colloid solutions. However, these remarks do not affect the high opinion of the thesis and are indications of further development of proposed approaches. And the author also observes that the thesis reviewed deserves encouragement, and the applicant deserves to be awarded a degree of Doctor of Chemical Sciences. And the fifth last review submitted by Professor Novikov, Russian University of People's Friendship, Doctor of Pharmaceutical Sciences. Here the author also mentions sufficient amount of literature, a combination of targeted delivery of cardioprotective with fluorescent tomography enables to create a conceptually new sphere of teraностиcs, of ischemic heart damage. And he believes the thesis, the work of the deserves high esteem. At the same time, the following drawbacks he points out: small amount of studied cardioprotectors and contrast. Second, data on biodegradation in vivo are only available for silica nanoparticles. So the whole chapter seems to be incomplete. And further goes on to say that the thesis meets the requirements applied to doctoral thesis, and the applicant deserves to be awarded a degree of Doctor of Sciences. So let's read all the reviews, and then yes, and I will give all my answers in the end. First, let's give the floor. I have a list of reviewers. Torchilin Vladimir Petrovich. Shall I read it? Shall I read all of my review? Because the introduction, which emphasizes importance of task, original approach, or maybe I would rather read the most important achievements and some critical remarks that I have. First of all, from the point of chemistry, I was very impressed by a systematic study of several approaches to creation of such particles. This is very important, because it doesn't matter which was the best one, because now we have a whole set of possible approaches, and maybe somebody will need another approach for his purposes, but chemistry and descriptions and protocols are already available, and this is very important. Secondly, continuation of chemistry, the use of different spaces, because very often spaces are critical for properties of resulting substance, and the study of set of spaces. This was a very important and interesting move. And the fact that conjugates, which can be affected by external magnetic field. I asked this question earlier, of course, between supermagnetism and paramagnetism, certainly there is some difference, but in the end, if we judge by what was achieved, and under the influence of magnetic field, particles were synthesized and their magnetic susceptibility is sufficient to the supposed function will work. And the author demonstrated quite clearly to spontaneous or passive accumulation of drugs in ischemic zone, and this of course is very important for the therapeutic effect. I was also very impressed by the part dedicated on the use of iodine containing X-ray contrast agent, iodoxanol, which may have a general significance, very general significance, because not only for ischemia or cardiovascular diseases, this can be a common algorithm that can be used anywhere. And what the author achieved was able to certainly success, and that's what the teranostics is trying to do. Multi-layered nanoparticles from a chemical and physical point, obviously they can have interest in pharmaceutical application. Some critical comments I also have. In a nutshell, at least in the copy of thesis I received, figures 1 and 2 show no errors, which in captions says p-value is smaller, but this makes p meaningless if there are no errors, so maybe you forgot, so it's impossible not to notice this. Second, this is a general misconception of people who are not dealing with this. Passive and active accumulation should not be seen separately. Active is a second phase of passive accumulation, because bottleneck limiting stage always will be passive. For active be actively captured by cells, it's necessary for passive get to the zone where such cells are present, and this issue was specially studied, first of all in the works of Papahandropoulos and Kirpotin. Next, someone's trying to reach me. Next, another comment. I came across a phrase that the first publication on targeting the ischemic myocardium appeared in 2009. This is quite strange because the first publication was published in 1977, 32 years earlier. And that's a classical article in the Science magazine by Carried et al. And after that, for 30 years, before 2009, dozens or probably hundreds of articles on delivery to ischemic myocardium for my laboratory, published maybe 15 articles on this theme. So this was some sort of omission. And a general comment regarding the list of literature, I don't know why the author quoted a great number of articles, not key articles published not in very important journals, and many articles, or key articles in best, such as Science, Nature, LPNS, have not been mentioned. Next, unfortunately, I admire the chemical part. In the protocols for determining the amount of reactive groups, the author did not mention sensitivity, accuracy, interval, experimental errors. That would be good to know, especially if in the future translation into practice is planned. And finally, some more actually. The author claims the size of nanoparticles 8 plus minus 2 nanometers to 15 nanometers. How was it determined? Because if electronic microphotography, it's hard to agree with that, because it's obvious that the difference in size is much greater. And finally, in the title, I have a comment about the title. The matter is, the results, there are very few therapeutic results, while the thesis is called Development of Drugs for Teраностикс and Targeted Delivery of Cardioprotective Substances, which implies that something you can use in the actual therapy. I would change the development of drugs which can be used for theranostics and targeted delivery. But these are very minor comments, or almost minor comments, and definitely they cannot seriously affect the positive impression I got from the thesis. And if I had to weigh, advantages are much heavier, have much more weight, and the applicant deserves a degree can be awarded to the applicant. Next, we shall give the floor to Poklonsky Nikolai Alexandrovich. Dear colleagues, I will give you a summary of my review. Can you hear me well? Yes, we can hear you very well. Thank you. The thesis by Korolev Dmitrii Vladimirovich summarizes the results of studies, theoretical and experimental, aimed at targeted delivery of drugs with the help of nanoparticles. Silicon magnetic nanoparticles. The theme of the thesis is obviously relevant as far as I can judge. Nanostructures and nanoelectronics. And an interesting task was spacer synthesis on the surface of nanoparticle. Everybody's trying to do this, and the author achieved good results. Fluorescent dyes, preparations on the surface, immobilization, everything was performed on good physical level. And scientific significance and novelty of results obtained by Dr. Korolev has priority character, and relies in the following. First, with the help of conjugate of silica nanoparticles with fluorophore in the cyanide green occurs other fluorophores can be used. The author shows delivery to injured myocardium of animals of drugs. The author synthesized conjugates deposited in concentration of magnetic field zone, and the effect of active magnetic guidance of conjugates in the ischemia zone, and the therapeutic effect. For the first time, nanoparticles of various nature, spacers, different types of spacers were immobilized. The author proposed platform on the basis of teranostics of one macromolecule. Credibility results is beyond doubt, because they are validated with careful analysis of vast experimental material and agree with their modern understanding of nanostructure physics and solid-state chemistry, medicine and physiology. Here, of course, other experts will talk better. On a higher methodological level, the author uses such modern research methods such as spectrophotometry, tartarian, and obviously this power spectroscopy, fluorescent analysis, etc. These methods, in some degree, one degree or another, are developed and widely used today. Results have been presented at numerous international conferences, have been recognized internationally. Here we mentioned 49 articles, 18 presentations, which corresponds the requirements, which means the thesis has been quite well presented. The language of the thesis is clear and logical. Number of illustrations and graphs is high, and the list of literature has been formatted in accordance with applicable regulations. Results correspond to specialty solid-state chemistry and medical chemistry. I included some chemical remarks, 11. Most of my chemical remarks connected with the already mentioned. 56% of literature. That's maybe too much, longer than the thesis itself. This list could be shorter, but this is only a wish. There are some mistakes or misprints which I will not name here. It's always good to use monographs directly if available. 10% is good, because for this power spectrometry is necessary to have 90% of iron 57. This is ideal. It's better. All physicists are trying to achieve spectrometry. That description misses when describing the voltage is not mentioned, speed is not mentioned. Obviously, the temperature was room temperature. This needs some small clarification. Comment 8. Figure 65 shows the magnetization curve. CD would be good to translate those into common units. For example, in Belarus, non-systematic units is an administrative violation. Hopefully this is not true in Russia. In figure 75, relative optical density, the author should have given a calculation, described calculation method. From the list of publication is not clear if all the results have been described in publications. In Belarus, it is required that each result is described in an article, and would be give a list of abbreviations, because for a physicist or some medical terms maybe not easy to understand. The thesis corresponds to all the requirements set by the order of St. Petersburg University, and I believe that the applicant, Korolev Dmitrii Vladimirovich, deserves to be awarded a degree of Doctor of Chemical Sciences, the specialty solid state chemistry and medical chemistry, for new results of his research, developing a technological basis for synthesis and targeted delivery of cardioprotective substances with the help of silica and magnetic nanoparticles, which enabled, I listed 5 synthesis with crystallized 10 nanometers scaling synthesis to semi-industrial technology, studying properties of obtained carriers, develop methods of surface modification of silica nanoparticles and magnetic nanoparticles, etc., to synthesize spacers and study conditions of influence of different substances on space efficiency, immobilize cardioprotective substances, quinacrine, to study reaction and speed of preparation release, which is also quite useful to such speeds. Metrology spectra, to implement the idea of X-ray construct action of magnetic nanoparticles with the help of iodine contrast agent, hydroxanol, and I'd like to say here that obtaining a structure nucleus shell, which includes therapeutic preparation, contrasting agent, and checking their biomedical efficiency, which together makes a significant contribution to the development of element base of theranostics and solid state chemistry on the basis of silica and magnetic nanoparticles. That's all I have to say. Thank you. Next, we shall give the floor to Professor Tolstoy, Valery Pavlovich. First of all, I'd like to say that I'd like to join what already has been the method about practical significance of this work, novelty and relevance. As for relevance, I'd like to make some clarifications here. First of all, mention relevance from the point of solid state chemistry, which we are discussing here. For decades, solid state chemistry already has this very popular sphere. This sphere in many works, creation of so-called multifunctional materials, and indeed material properties. When the 3D material, these properties already, we know them already. Speaking of nano, and for nanomaterials, we get a wide field for creation of new materials, so-called multifunctional materials, where we can use properties of 1, 2, 3 materials and synthesize new material with new properties. And this concept is quite well known, but there are not many works on this theme. Maybe that's because this is quite a challenging task for a chemist. He works in the sphere of preparation chemistry. But in this work, honestly speaking, the results summarize the synthesis of multifunctional materials. I was very impressed because one of the few where such materials have been synthesized, and these materials, the author proved that they have a big practical significance. A few critical comments I have here. For example, the author should explain which funds supported this work. This was not mentioned in the thesis or in the presentation. I think that will be that's a very significant point. Next, in conclusion, the author says that developed technology, synthesis of magnetic nanoparticles. I think the term technologies needs clarification. Is it industrial technology, laboratory technology? Because the word technology here can have many meanings, reproducibility, etc. And my third comment is the author doesn't mention type of spectrometry and low intensity bands on figures 86, for example, up to oscillations. This requires further clarification. Despite these critical comments, I think that the thesis certainly deserves high praise, and the applicant, Korolev Dmitrii Vladimirovich, deserves to be awarded the degree of Doctor of Chemical Sciences. Thank you for your attention. Thank you, Professor Tolstoy. Professor Sharoyko Vladimir Vladimirovich. Thank you. I would like to join what was already mentioned earlier, and on my behalf, I'd like to say that despite the thesis in chemistry, big interdisciplinarity, I'd like to comment on, which demonstrates high knowledge and skill of the author, which makes the thesis very interesting. And I suggest also to consider Korolev Dmitrii Vladimirovich deserves a degree of candidate of chemical sciences. Thank you. Vladimir Vladimirovich. Garbadziu Alexander Vasilyevich. I will be brief here because I don't want to repeat what was already mentioned. I will just mention the key points for novelty and relevance. The work is very interesting. I enjoyed reading the analytical review, which I think is a bit long, and this was also mentioned by other colleagues. Second point, the author entered a very complex field where it's necessary to combine properties of different substances, and it's very seldom it happens that joining two substances responsible for different properties, we achieve additivity. Usually one prevails over the other, but judging by how the work was performed, I think the author succeeded to preserve both, though one of the reviewers mentioned that I was a little bit wrong when I said that very few works on delivery of cardio preparations, so this is quite common sphere. About but now I'll go back to my questions. It's very hard to use, especially in in vivo experiments of fluorescent dyes, because the danger of transition is extinguishing is very high. Did you observe this? So this is very the greatest challenge. Also, I'd like to say what I didn't find in the thesis. Do you have any understanding of toxicity? Because this is the principal challenge of world science, working on nano preparations. I also want to ask this question because I worked with one of the patriarchs of Russian biotechnology, academician Schwed's, now late, hypersomal means of delivery, and he put into practice 24 preparations for delivery of different hypersomal combinations. Here everything was liposomes can act perfectly similar in similar. What about nanoparticles? Silica nanoparticles is a different story. So this here I would like to focus on this, and in conclusion I'd like to say that the thesis is definitely very interesting and deserves the degree. This is our degree. Professor Malygin, Anatoly Alexeyevich. I will try to make it short also, because already many things have already been mentioned about relevance and addresses and dealing with complex tasks, solid state chemistry, medical chemistry. Of course, certainly enables us to achieve new results, unexpected results. Medical chemistry, this niche is quite not very well studied. And that is why here the question about relevance and novelty and practical relevance doesn't need any further discussion. This is very obvious. That is why I will proceed to my comments and maybe advice to the author. First part, too many experimental studies for modification, but unfortunately the regime of these processes is not described. It's new approaches to synthesis. Regimes should be described. If these are familiar, so references should be given. For example, for magnetic particles, for example, as carriers of medical preparations, there are many publications. So it will be interesting what's new in the method used by the author. And a second minor comment is method on page 134. The author makes proposition of porous structure of chitosan coating on a nanoparticle. So it will be interesting to not only to suggest such porous structure, but provide experimental data on porous structure and size of pores and thickness. And so I have some comments to the structure of the thesis. The literature review should be made shortened. The methodological part could also be shortened with methods used for analysis. As for quoting literature, quite many references would be good to mention achievements. Nobel Prize winner Merrifield, who developed soil phase synthesis, and numerous publications by Georgy Vasilyevich Lisichkin, professor at Moscow State University, the author whose and minor comment on axis would be in not in days but in hours. Time axis should be marked in days, not in hours. As solid state chemistry and medical part, but in all the publications, 8-10 co-authors. I understand that such work cannot be performed by one man. And of course, Dmitrii Vladimirovich mentioned that he was the leader of a group, but it will be interesting maybe today to hear some general comments from Dmitrii Vladimirovich, what was his personal contribution, some general conclusions on about this. All these comments and critical remarks are only wishes or suggestions, not serious criticism. And I also agree that I'd like to join my colleagues that definitely the work is relevant, highly relevant, useful, and for personalized medicine illustrates very well the connection, such interdisciplinary nature of solid-state chemistry and medical chemistry. And certainly Dmitrii V Korolev deserves to be awarded a degree of Doctor of Chemical Sciences in two specialties, solid-state chemistry and medical chemistry. Thank you. Thank you. Next, I would like to give the floor to Ostrovsky Vladimir Aronovich. Thank you, colleagues. You made my task very easier. So I'll start reading my review from the end of page 4. This important choice of object of study. Multidisciplinary nature makes it very hard. And with understanding, I accept that the author had to justify the choice of selection of object, not only from clinical, but with the need to realize functioning of all chemical and harmonized in the integral mode. So I will not criticize the algorithms suggested by the author. I will just limit myself to cardioprotective as substances. The author uses adenosine, bradykinin, acrohine. The author calls it 4 different names: metrogen, canacrine, AKN. This is same acrohine, which I didn't like so much. Next, 2 types of nanoparticles were used by the author, as we know, as we have heard. One of these types is silica nanoparticles used. Commercial samples and nanoparticles were generated by the author using his unique methodology. Visualization, the author used different methods: fluorescent dyes, quinacrine, which I already mentioned. Is an interesting solution was the use of so-called colloid dots, non-toxic fluorescent dyes, which the author colloid quantum dots and besides, was already mentioned, the author considers the possibility to use in oncology, cardiology, contrast agents, abbreviation hexanol. The results can be summarized in put in 5 major groups connected which are all connected with each other. Conclusion of study of physical and chemical properties of biodegradability. Biodegradation of nanoparticles is very important. Obviously, controlled degradation is hard to achieve, especially comparing such process with nanoparticles of different types. Here, the author achieved success because of precision methods, got control of a state of studied objects. I will not list this here. This was already mentioned by my colleagues. How many methods were used by the applicant in his work, modern methods, precision methods, and this was not mentioned before, but colleague used modern method processing of physical chemical results, such as, for example, methodology, Brennauer, command of such list of precision methods, good understanding, good using interpretation methods, prove high skill, knowledge and of Dmitrii V Korolev. Unfortunately, having such big, it's hard to avoid inaccuracies in data and interpretation, which was already mentioned. Figure 54 is a change of linear dependence. Figures 51, 54, optical concentration, and weight in micrograms on axis studied. So design, the synthesis of terminal fragments of pharmaceutical ingredients. Obviously, this type of manuscript is directly medical chemistry, which encouraged me to talk about this a little bit. We're also talking about design. The A task is transport of active ingredients to biological target, specific impact on the including visualization of process and degradation of particles. Let's draw attention to the fact that our targeted delivery cannot be strictly determined, since a target, unlike cancer cell, is not localized. It doesn't have exact localization. As here is important active pharmaceutical ingredients and development of design and mobilization of fragments on the surface of particles. The choice of fragments and active depends on several factors. The applicant is very persistent, yet it is necessary to understand how complex the task, not only in covalent ions, active pharmaceutical ingredients and surface structures, but also in ensuring compatibility. Impressive example given in figure 100. It's not always obvious, and the chemical transformation is not obvious because synthesis methodology is not sufficiently described. And unfortunately, molten reagents, catalyzers, and mixing conditions and production of targeted products. Let's look at a simple example of a glycinide spacer, figure 103. Obviously, the key stage is purity ratio of simple ethers. It's well known that this process can be reverted. Obviously, getting product of purity is only possible with permanent goal of easy boiling alcohol, methanol. These three dissolvents, cyclohexane, benzene, and toluene. Which of these solvents was actually used, the author doesn't say. Blank regimes and inhibitors in vivo experiments, which I think is a strong point. I know how often we contact biochemistry and how difficult it is to maintain this contact. And this research is very labor consuming. The author of the thesis, because of obviously works, had sufficient conditions for good cooperation with biochemists, and this enabled the author to study samples obtained on laboratory animals, and by assessing labor, it's easy to compare with works of Paul Ehrlich, who was a genius chemist, technologist, and manager. He developed salvarsan, was the first efficient synthetic medicine against syphilis, plague of the 20th century. For this, he had to synthesize 606. Paul Ehrlich described the possibility of using some approach, so-called drug bullet, which today we identify with molecular teranostics. I'd like to say that a reviewed thesis by Dmitrii V Korolev has been a relevant theme, contains necessary elements of novelty and relevance, and experimental data are reliable. There's no plagiarism. fully. During this study and research and development, the author first addressed a very challenging fundamental problem, developed original methodology to targeted delivery to biological targets of active ingredients for the cardiovascular diseases. Scientific and technical solutions developed by the author are of pioneer nature. I'd like to say that graduate St. Petersburg Technological University, Korolev specialty chemistry and technology of heterogeneous systems and specializations, in which he defended his candidate's thesis, chemical technology of fuel and specialized product, were very relevant for successful implementation of plans of doctoral thesis. Unique experience applied in cooperation with technology. One of the nano diamonds and nanostructures are being studied very carefully. Critical comments. Designing molecular structure of active pharmaceutical ingredient, drug design, means good knowledge of 3D structure of the target, ferment, cell, bacteria, etc. Structure of molecular ligand. The thesis doesn't answer the question of molecular structure, supermolecular compounds in active interaction with the target. As how does transfer occur? What happens before with the transport element of and what happened by that time with transport element of drug charge, and if a drug bullet has been detached. These questions are related with pharmacokinetics of bio and chemical degradation on particles and fragments. Bringing to pharmaceutical like original preparations is regulated is regulated by good laboratory practice and good manufacturing practice. Is it possible to organize due supervision over norms and practices, such nanostructured objects? These questions are not of critical nature and do not affect the overall positive impression. The thesis by Korolev Dmitrii Vladimirovich, the name you know, corresponds to the basic requirements set forth by the order, the 6821/1 on awarding academic degrees at St. Petersburg University. And the applicant Korolev Dmitrii Vladimirovich deserves to be awarded the degree of Doctor of Chemical Sciences, specialty 020021, solid state chemistry, and 020016. Clause 11 of the above mentioned order has not been violated. Thank you. Next, I will give the floor to Doctor of Chemical Sciences, Simonov Konstantin Nikolaevich. Dear colleagues, I will try to be very brief and I looked at World Health Organization data, and I'd like very briefly to give 10 top reasons that led to deaths, ischemia, but 10 million deaths, 10 million strokes, 6 million. So these are some reference value. Respiratory system infection, road accident, 1 million. Tuberculosis, 500,000, last place. So these emphasize relevance of the thesis of Dmitrii Vladimirovich. On the other hand, Dmitrii Vladimirovich, in the beginning of his presentation, mentioned that according to Scientometric database, 6,000 publications dedicated to theranostics preparations, 3,000 in the sphere of oncology, and these approaches are quite well known. These are structures which include carriers of medical preparations and various molecules which used for targeted delivery, can be used for targeted delivery, conjugates, which include substances for visualization. But in case with cardioprotective agents, only 6 publications dedicated to this. So within his thesis, Dmitrii Vladimirovich developed new scientific field, preparation for theranostics, of cardioprotective preparations. And in his thesis, he obtained a great amount of experimental data on synthesis, identification, nanoparticles of different nature, creation of conjugates, and it's also impressive. Biomedical component of the thesis is also very impressive. From my point, I'd like to say, of course, the thesis by Dmitrii Vladimirovich corresponds to the key requirements on the order of awarding academic degrees at St. Petersburg University. And Dmitrii Vladimirovich deserves to be awarded the degree of Doctor of Chemical Sciences, specialty solid-state chemistry and medical chemistry, but I'd like to say that despite, if visit Almazov Institute, you may see many quotes by Vladimir Andreevich Almazov. Heart can be cured only by heart, but developments of and approaches developed by Dmitrii Vladimirovich in the future can be used to save many lives in the future. Thank you. Thank you. Next, shall give the floor to Doctor of Chemical Sciences, Shilova Olga Alexeyevna. Thank you. I think the thesis by Korolev Dmitrii Vladimirovich is interesting as a piece of interdisciplinary writing, because there are many studies and many publications on synthesis of different particles, different methods, but combination of synthesis and usage for medical purposes, this is very interesting. And this makes this, that's why the thesis meets two specialties. From the point of chemistry, it's interesting to know, questions have already been asked about toxicity of these magnetic nanoparticles. Degradation is quite hard to synthesize, is quite hard to study these objects because of their magnetic nature. Everything is quite, because we are also working with such objects, we run into it's difficult to obtain single phase, and you mentioned two phases in your thesis, so that's why I get some doubts in oxidation. This was not mentioned here, and it's a shame that Ms. Bauer was used and there was no division by valency, because valency, in my opinion, and this is also described in literature, affects toxicity of materials that we synthesize. 2-valent, 3-valent iron absorption is, so this is more of a wish. Maybe in the future you can divide, give a better division by phase and valency, and choose most important ones. Also, so what can impact toxicity, magnetic field. Speaking of toxicity, we shouldn't forget this factor, neglect this. Speaking of magnetism, of course, core shell, I think was good. This was a good name, but from the point of, to me, all the how it was proved, I was not convinced. It was not convincing to me, and one of the layers, one of the deep layers, was studied after that. So maybe that's this is a challenging task, but maybe it will be interesting to study this in more detail, interaction between layers and their structures. But these comments are not; these are not critical comments, and which create no doubt that the thesis deserves and the author deserves to be awarded degree of Doctor of Chemical Sciences in 2 specialties. Thank you. Thank you. Next, Doctor of Chemical Sciences, Kudryavtsev Konstantin Viktorovich. Dear Chairman, dear members of the Dissertation Council, dear colleagues, Dmitrii V Korolev, to some degree in his work, changed my vision of medical chemistry as science, because as someone who has a degree in medical chemistry, always thought that medical chemistry should approach from organic chemistry, which was very clearly demonstrated by Professor Ostrovsky. Dmitrii Vladimirovich approached this specialty as any specialty it has described by a higher attestation commission. He approached this science from the side of material chemistry or non-inorganic chemistry, yet delivery of medical preparations is included in passport of specialty 020016 medical chemistry. So positioning suggested by Dmitrii Vladimirovich to some degree is justified. Of course, here many opinions have been expressed and different evaluations, and members of the Dissertation Council did an enormous job, because they made easier future scientific life of Dmitrii Vladimirovich, because he has a ready plan on how he can improve drawbacks and in which direction he should move to continue this work to achieve new results. And all the data on relevance, novelty, practical significance I have already included in my review, and I think all the guests, anyone interested, can read my review on the university website. My critical comments, remarks refer to issues connected with organic chemistry, because some issues, chemical issues, mentioned by Professor Ostrovsky earlier, reaction of applying spacer, glycine spacer, aptis. I will not I will not dwell on those. One thing I'd like to say, that the thesis, except for problems with describing some chemical processes, when describing biological experiments, the details of laboratory animal experiments are missing. The number of animals is not mentioned in test groups, and reproducibility statistics. Yet, I would like, we all referred to colleagues from St. Petersburg University. They are familiar, so I also read this provision on, and in conclusion, I have, the reviewer had to read not only the thesis itself, but also has a responsibility to read the works published by the applicant, and indeed in the works published, in patents obtained, received by the applicant, in articles, data is on animals is available, actually. And to sum it up, the drawbacks, of course the thesis has certain drawbacks, but summing up the results, their novelty, relevance, and presentation, we may conclude that Dmitrii Vladimirovich produced work which contains new scientifically justified solutions which give new instruments for therapy of cardiovascular diseases. And the thesis by Korolev Dmitrii Vladimirovich, development of drugs for teраностики, targeted delivery of cardioprotective substances based on silica and magnetic nanoparticles, corresponds to the basic requirements set forth on the 1st of September 2016, number 6821/1, or awarding academic degrees at St. Petersburg University. And the applicant deserves to be awarded the degree of Doctor of Chemical Sciences, specialty 020021, solid state chemistry 020016, medical chemistry. Clause 11 of the above mentioned order has not been violated by the applicant. Thank you. Now I will finish the reading of reviews. The applicant should make himself ready to answer all the comments. I liked the work by Korolev Dmitrii Vladimirovich. It has all the necessary elements, all within reason. Of course, there are some minor details which call for improvement. And in conclusion, I'd like to give the following comments, suggestions. When the applicant explained the purpose of his work already at that stage, he said that the purpose of his work is development of technological basis for synthesis. This was the purpose. He mentioned that as the purpose of his work. I have some doubt about correctness of mentioning development of technological basis of synthesis of drug preparations, etc. The phrase is motivated especially for of scientific basis, not technological basis, etc. Scientific basis for method of modification of silica particles with average diameter of 36 nanometers, monomolecular layer, aminopropyl 3-trioxyxylan in pseudo liquidized layer. How did the author manage to implement in such small individual nanoparticles pseudo liquidized layer without pneumotransport? And third, from the thesis is not clear what's the maximum amount, percent of medical preparation can be delivered to diseased organ if take amount of medical preparation to 100%. These comments do not affect the value of the thesis, and the thesis by Korolev Dmitrii Vladimirovich corresponds to the basic requirements set by the order St. Petersburg University, and applicant Korolev Dmitrii Vladimirovich deserves to be awarded the degree of Doctor of Chemical Sciences. That's all I have to say. Now please answer all the questions. Dear Vladimir Mikhailovich, dear colleagues, I'll take answers about questions in graphs. We calculated and the graphs were given in publications, and Vladimir Petrovich was a mistake to use graphs from my earlier publications without this deviations. As for your second question, here I fully agree with you. The passive targeting is the initial stage for active targeting, since active targeting can only be carried out in a required area only after accumulation of some preparations. As for your third question or comment, I fully agree with this, and I will use in my future work what you have told me, what you have next comment is connected with the previous one. I tried to review relatively new recent publications, and maybe this affected the background of this issue. Thank you for your criticism. As for the protocols and analysis of functional groups, we performed at least 5 times, and standard deviations have been calculated. So that's a stupid mistake, and it's a shame I did not include this, because this information is given in my articles. As for particle size and microphotographs, we took quite a lot of them, and we calculated the average size, and the average sizes we obtained were like this result. In addition to photographs, we used a size of specific surface, which we measured by macro photographs. As for the name of the thesis is too loud, too big. Yes, indeed, my results are still far from practical application and should be seen as development of approaches that can be used for theranostics. Nikolai Alexandrovich, as for your first question, was a very good comment in the introduction. Indeed, I used a definition from Wikipedia. Had to start somewhere. It was not a word by word. It was not used word by word. As for literary review, yes, this could be more elaborated, and this was mentioned. Analytical review could be made shorter. For error with numbering, yes, this was a mistake, maybe the last iteration while editing the text. This should be taken into consideration. I agree with comments 4, 5, 6. These are misprints. I totally agree. Yes, I have those. As for analysis of spectrum, the literature describes a method based on approximation of experimental spectrum, sum of analytical functions. I should have referred to this or explained in detail. And as you said, the measurements were conducted at standard temperature. Next comment, number 8, on Misbauer's spectrum. I agree. I'd like to explain that axis, ordinate axis, the number of counts on ordinate axis. Of course, there's the number of counts. conditions of the experiment should be given in more details. As for comment number 9, chemical composition of the sample is described in analysis of Miss Bauer's spectrum. So I saw no point in repeating it. Magnetometer brand is mentioned, is given in materials and methods. As for in my presentation, I show the graph in different scale. As for figure 75 and interpretation of data shown in this figure, I also agree. Used approximation is a reverse polynomial, second degree. In my all the publications are available, all the details are available in my articles. Comment. Results been published. Not all the results have been published. We are working on several articles at the moment, and we plan to take part in several conferences. It's impossible during such a short period of time. It's impossible to publish everything. As for list of abbreviations, I agree we should have made such a list, but this became obvious when you write when writing thesis. Your eyes become dull, and when reviewers submitted their reviews, it became obvious to me also. Valery Pavlovich, as for grants, as I read the reviews before, I made a list of the work supported. My work was supported by 7 grants. More actually, not 7 but 9 in reality, because the first grant was we received in 2009 when our laboratory of nanotechnology was established, and then this grant we received in 3 stages. Was dedicated to preparations of targeted delivery, and then we received some more grants and so we're still working on fluorescent visualization. As for the development of the synthesis of magnetic nanoparticles, so word technology, is a special research and development project supported by a Botnik Fund, developed not a method of synthesis but industrial methodology from quality control all the way to quality control. So I think the word technology is appropriate, is justified here. As for spectrometry, we used Nicolet spectrometer, Nicolet 8700. Samples analyzed in bulk form is an integrating sphere. As for low intensity bands, we should be able to conduct additional research, additional measurements on ordinate axis. Normalized optical density we had as a term, variable intensity. I did not invent it. Took it from a guidebook. As for Vladimir Vladimirovich Sharoyko, only no critical remarks, so I will not dwell on those. Alexander Vasilyevich, I absolutely agree with your comments. Should pay more attention to analytical review. As for materials and methods, results and discussion, I should have described in more detail. As for nanomaterials, you mentioned liposome. I know that you've been working on this under your guidance. Yes, we also work with liposomal forms, magnetic liposomes on the basis of our magnetic nanoparticles. So we included nanoparticles into liposomes, and we think this is a promising method. So we're working on this also, but we have so many results which I did not include in my thesis. Anatoly Alexeyevich, about the methods of synthesis. There are three main methods of synthesis of magnetic nanoparticles: nitrates, chlorides, and sulfates. Nitrate synthesis occurs in acidic environment, and chloride synthesis is also challenging and it's difficult to wash byproducts away. So we thought that synthesis from sulfates seems to be most available type. So we created technology product can be washed easily, and because we developed technology and technical documents, the whole research and development supported by Bortnik Foundation. So I called this a separate technology developed by us. About pores, presence of pores on ketosine coating, we assumed presence of pores on reverse titration involves etching nanoparticles through the shell. So the coating should be porous. So indeed here we did not study the porous structure. This was an omission. About the analytical review, same as true. I should have made it shorter about the methodology, the methods. Usually these are not standard methods, because as standard methods we had to adapt them to our needs, solid state chemistry, while methods we borrowed from different spheres, from food industry, from steel processing. So I thought it was possible to describe them all. And about some fundamental articles, three reviews published in nanotechnology and ecology of production, and two reviews are published in Technosphere magazine, which closed unfortunately last year. Vladimir Aronovich, for your first comment, we used well-known cardioprotectors, which they could not find application in clinical use for one reason or another. So it was important to study kinetics of release of active substance. We conducted such experiments. For example, release, adenosine release, kinetic of release of creatine phosphate or arginine was studied. So we studied properties on macro level. As for GLP is a quality management system for laboratory research, and according to Russian laws it's mandatory to use GLP in toxicology. Our testing center under now is working for a lac audit, which can be seen as a step of being certified, GLP certified, which we plan to obtain in the future. Konstantin Nikolaevich Semyonov had only wishes, no critical comments. I will not dwell on those. Olga Alexeyevna, First question is more of a wish. Will be very interesting about iron 2 and 3. So far we haven't gone there so far. As for the structure of nuclear shell, so there is some introduction to this final chapter. So we thought a core shell structure. We thought solid state chemistry indeed implies applying coatings layer after layer. Of course, it could be studied in more detail, the layers of this structure. Konstantin Viktorovich, about your first comment, it refers to common knowledge. I absolutely agree with it. We could not use this method, and thank you for explaining. We had a different, we made a different proposition. As for covalent bonds, maybe we should put more focus on this. Just say that different strong bonds, of course not, I agree. So was it covalent, this bond or not? As for glycine spacer, of course, the terrification because no agent. We mean ionic bond, halide complex of halide complex type. There are preparations, ion preparations. So we had this mechanism in mind. Natural. There are some works on this which do not describe mechanism. Glycine resides under normal conditions, settles on magnetic nanoparticles, and we had to explain it somehow. So we the complex is formed, some chemistry must be there. This is a point for discussion. I suggest we discuss it after this session, outside this session. And as for water, environment, and table corresponding. Indeed, reagent undergoes hydrolysis. As a result of hydrolysis, it goes through polycondensation, partly on the surface of nanoparticles. Thus, we obtain coating on the surface of nanoparticles as a result of hydrolysis. And missing data in the table is not because of zero content, because we could not measure the total amount. The reverse filtration oxidize nanoparticles, and we get inadequate results. That's how I would explain this. As for spacer and functional groups, I use this in my presentation. Here I would suggest compromise option. We talk about spacers ending in functional groups. Of course, spacer is an insert. That's all. As for number of animals, indeed, this was mentioned in my articles. Groups included 5 animals. And you found this information already. Vladimir Mikhailovich. As for technological, scientific foundations, of course, scientific would be more appropriate. I absolutely agree with you. As for method of modification of nanoparticle, average at size of 36 nanometer, the mode is realized on silica agglomerates. These agglomerates have electrostatic interaction nature, and the entire surface which particle is available. We tested that, which can be proved by measuring surface before and after. Molecular layering occurs in stage 1, during stage 1, and after that more layers are applied in the reactor we built. Size of nanoparticles, we obtain particles of such size. Initial particles of 8 nanometers, we increased their size to 30 nanometers. As for pneumo transport, of course, we had it was vaporized nitrogen was fed. Thank you. The last question is my answer is very simple. A critical milligram per gram can be converted to percent. Did not occur to me. Now the situation is this: all the members of the dissertation council have spoken. Maybe someone, any of the colleagues present here, would like to say something nice, or maybe not so nice. No one wants to speak. Okay, then let's move forward and give the floor to scientific advisor Muri. Dear colleagues, over the years I've worked, or decades I've worked at the university I've been with St. Petersburg University for over 50 years, and been chairman of the dissertation council. I've been 35 years. A thorough analysis, I don't remember more thorough analysis, new defense rules, which so they have have certain benefits. The new rules, they enable us to take a very close look at what was done by the applicant, and if this is this direction we need to go. About interdisciplinarity, which was mentioned by many speakers today, indeed, for the first time in our council or at our university, once we start using the rules, maybe first or second time the thesis in two specialties is being presented. First time this was in the Faculty of Economics. In solids, first time is happening with solid state chemistry and medical chemistry. Both specialties are interdisciplinary, and when these two specialties are combined in one work, this results in many challenges, and to perform such research is necessary to be brave, have good communicative skills. It's necessary to conduct research with many methods, synthetic methods, using different synthesis methods, soft chemistry, complex methods, analysis methods mentioned today. The opportunities, 25 resource centers at the university. These are the unique opportunities, and of course, the author of the thesis and his colleagues maybe so they don't have enough time to get into these or that method. Olga Alexeyevna said that Ms. Bauer and Dmitrii Vladimirovich was quite right at using fluorescence because this is the most adequate method to analyze iron-containing compounds. And the question about iron 2,3 is very relevant for toxicity. This calls for more analysis, of course, because we know that magnetite has a ratio of 3-valent, 2-valent, and 3-valent iron. And so we small amount. We need some time for this analysis. For biomedical application, the mandatory phrases I have included. Of course, I will not give you numbers of orders, and the last sentence so the applicant deserves to be awarded the degree. I would just say that professional peculiarity of Dmitrii Vladimirovich and his authority at the university. Dmitrii Vladimirovich represents two institutions, Almazov Institute. Unfortunately, we don't have. Oh, yeah, we have. I apologize. Excuse me, I sat with my back to you. Chemical faculties of St. Petersburg University. That is why the authority, reputation of Dmitrii Vladimirovich and his institute at our university enabled him to make him the chairman of the Council for Chemistry, Physics, Material Mechanics, which many years ago was first created at two universities, Moscow University, St. Petersburg University, through effort of Yuri Tretyakov. Became faculty of Science of Materials and your humble servant. So Dmitrii Vladimirovich is a member of the State Examination Commission Board. So all these aspects hopefully will bring you to conclusion that adaptation to university became a good member of our team, and many conclusions he obtained through cooperation with Solid State Department and resource centers enable the applicant to obtain results, reliable results, good results, valid results, and make strong, important, significant conclusions in this such complicated sphere, knowledge sphere as chemistry. So thank you for your support. Thank you. Thank you. And, we have more answers than questions, and I think this thesis was a good demonstration, and I think that our speaker today and the team he's working with, they are constantly searching for new questions. Thank you. Now, next, we have 15 minutes to discuss results. For that period of time, broadcasting shall be suspended and guests are requested to leave the council room, and please don't go too far. I will invite you soon to come back.
Вот это я все записал. За, все записал. Проговорить, а что проговорить? Ну, переходим к...
So let us now proceed to the results. Let's resume our meeting. Please resume online broadcasting and make sure we are on air. Next, I now put awarding the academic degree to the open individual vote. Let me remind you that the decision of the Dissertation Council on awarding an academic degree shall be considered positive if more than a half, but not less than 3 members of the Council, according to Article 23 of the procedure for awarding academic degrees, since our defense takes place in 2 specialties, in order to make a positive decision, it's necessary that at least 3 members of the Dissertation Council vote for each specialty. Now, let me repeat what I have already said. Medical chemistry, Council member Sharoyko Vladimir Vladimirovich. I'm for. Council member Garabaju Alexander Vasilyevich. I'm for. Council member Kudryavtsev Konstantin Viktorovich. I am for awarding the degree. Thank you. Council member Ostrovsky Vladimir Aronovich. I am for awarding the degree, Doctor of Chemical Sciences. Council member Torchilian Vladimir Petrovich. I am for. Thank you. Thank you, thank you. Solid state chemistry specialty. Tolstoy Valery Pavlovich deserves to be awarded the degree. Maligin Anton Alexeyevich. I'm for. Semyonov Konstantin Nikolaevich. I'm for awarding the degree. Shilova Olga Alexeyevna. Yes, I'm for awarding the degree of Doctor of Chemical Sciences. Poklonsky Nikolai Alexandrovich. I am for awarding the degree of Doctor of Chemical Sciences. Thank you. And myself, I am also voting for awarding the degree. Now let me count the votes, which we have already counted, and all the members of the Dissertation Council, all 11 members, voted for. Including solid state chemistry, 6 members, specialty medical chemistry, 5 members. No one voted for and no one abstained. Next. A decision to award the degree of candidate of Doctor of Chemical Sciences, specialty 020021 solid state chemistry and 020016 medical chemistry to Korolev Dmitrii Vladimirovich has been made. It says here the final word of the applicant. Dear colleagues, I would like to express my gratitude to St. Petersburg University for granting me the opportunity to defend my thesis. Many thanks for expert work of all members of the Dissertation Council. Special thanks to foreign scientists who found time in their busy schedule to write reviews and get in touch with us, get online via Skype. Very grateful to my colleagues who supported me during the decade this work was written. Thank you, everybody. Thank you. At that, our session of the Decision Council is closed. Please stop broadcasting. Thank you. That's all.